All right. Well, good afternoon. My name is Dr. Julie Bates, and I use she, her, and hers pronouns, and I am AARP Interim Senior Advisor for Age Inclusion. Thank you for joining our panel discussion today on what older LGBTQ people need when the country begins to recover from the pandemic, presented by AARP. For those of you who don't know much about AARP, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 and older to choose how they live as they age. AARP produces the nation's largest circulated publications, AARP the magazine, and the AARP Bulletin. With over 1 million LGBTQ plus members, AARP is proud to represent a generation of LGBTQ Americans whose courage and dedication helped pave the way for many of the rights that we have today. We encourage you to think of AARP as a helpful resource that can supply experts and research and compelling personal stories that you need when you're thinking about LGBTQ people in your workplace. AARP's resources are for everything from LGBTQ members and caregivers and beyond, and they can be found at aarp.org/pride. Now, today we're going to be talking about the pandemic and its unique impact on LGBTQ people. Again, LGBTQ plus Americans more often face disparities when it comes to their health than their non-LGBTQ counterparts. Though they are more likely to report being in poor health or condition, AARP research shows that many are concerned that they will face discrimination by their healthcare providers and others. They might have challenges affording their life-saving prescription drugs, and many of the community are at increased risk of experiencing social isolation and loneliness as they age. Now, it's not going to just be me talking to you today. We have a wonderful panel that has come together to talk with you about this issue. So first, I'd like to introduce Cassandra Kantov, AARP Senior Research Advisor. She's overseeing crucial projects that shine a light on older LGBTQ Americans, such as our Maintaining Dignity, a survey of LGBTQ adults age 45 and older, and many others. Thanks for joining us, Cassandra.
Thank you, Julie. I'm so excited to be here.
Next, we have Christy Mallory of the Williams Institute. Christy holds a JD and is the Renberg, I hope I'm saying that correctly, the Renberg Senior Scholar and the Legal Director at the Williams Institute, and her work focuses on state and local laws and policies that impact LGBTQ people. Welcome, Christy.
Thank you. Glad to be here.
And then we also have Jackie Bishop joining us today. Jackie holds a master's in public health, and she is an icon in the LGBT community. And in addition to that, she's a program specialist with the Massachusetts State Office of AARP. Welcome, Jackie.
Hi, Julie. Thank you for having me.
And then finally, we're joined by Dr. Nick-Corte, Senior Advisor of LGBTQ in the Office of Diversity, Equity, and Inclusion at AARP. Dr. Corte has social impact advocacy has been central to his life's work, most prominently related to initiatives addressing social determinants of health and issues advancing civil and human rights for all. Until recently, he was on special assignment at AARP regarding multicultural engagement for our work on COVID-19. Welcome, Dr. Corte. You're on mute, Dr. Corte.
Thank you, Dr. Bates.
Well, we're glad that you're here. And we're going to jump right in. But before we do, we really do want this to be an interactive conversation. We have some questions and we have some information that we're going to be sharing with you, but we really would like to have the opportunity to answer the questions that you may have. So please feel free to put questions that you have for our panelists into the chat. And Cassandra and I will do our best to go through the chat and keep those questions coming to our panelists. So first, I'm going to start with you, Cassandra. What is the data? What is the data saying in AARP research on LGBTQ people and the pandemic?
Sure. So again, I'm so grateful to be here to be able to share some of the work that we've been doing. AARP is really devoted to being a strong ally to the LGBTQ community. And one of the ways that we're doing so is through the research. I think Julie mentioned our Maintaining Dignity study, which was our landmark LGBTQ study, and two others that I will talk about throughout the course of this is the Black LGBTQ community study, as well as our Vital Voices LGBTQ 45 plus study. And the work that we're doing through research kind of helps to inform the strategies and helps us to understand what's happening within the community. So particularly around the pandemic, we know that COVID-19 was a health concern for everybody, but more so for the participants in the Black LGBTQ community study that were over 55. And they did note some negative health outcomes such as social isolation and mental health, but also there were about 25% of the participants that were 45 plus that said that they knew somebody, whether it was a family friend, a family member, or a friend that had died from the disease. And for baby boomers, that increased to about 31%. Some other negative impacts were financial well-being, where 30% of our respondents said that financially they had a downturn, and about 22% said it negatively impacted their employment status. And I know that this is something that you will touch upon later, is that we often know that LGBTQ people are some of the first to be let go when there's a layoff or a workforce reduction. We also asked a battery of questions in our LGBTQ Vital Voices study. And one of the things that really stood out were the number of people that were caregivers that said that caregiving was more difficult in the midst of the pandemic. And we can imagine, right? If your loved one doesn't live in your household, or if you're an essential worker, you have to navigate all of these things. And with COVID, everything is changing so rapidly. So one thing I will also say is that we have some new data coming out. We have the data that will soon be available for our 2021 LGBTQ Vital Voices study, where we did ask some questions around the vaccine and around boosters. So I'm looking forward to sharing that at a later date.
Thank you so much, Cassandra. Now, Christy, I know that you have been working with AARP through the Williams Institute to better understand, the situations showing that older LGBTQ adults were impacted more severely than their non-LGBTQ counterparts in regards to the crisis. What insights can you share with us in regards to that? I'm going to pull up an infographic to help as we go through this conversation.
Great. Yeah. So I'd love to talk about the study that we recently did with AARP and the esteemed colleagues of mine on this panel. So this study grew out of some conversations with the folks on this panel based on an earlier report that we'd done looking at data collected on the impact of COVID-19 on LGBT people that was collected through a survey administered in late 2020. So if you can kind of put yourself back in that time and what it was like, the election had just happened. It was the worst surge of the pandemic that we've seen. People were still, months later, unable to find jobs. There was more job loss happening as another shutdown came around. So this was really a critical time to find out about what was going on with LGBT people. This was also at a time where there wasn't much data out there about LGBT people's experiences with the pandemic. The Federal Household Pulse Survey until recently did not ask questions about sexual orientation and gender identity. So we weren't actually able to identify LGBT people in that federal data set, which is huge early on. So this data that AARP has worked with and this data that we're bringing to you was really only the picture we got of the impacts on LGBT people, while other populations we could easily study with federal data sets. So that's just a little background on the survey, but to talk about what we found, it really echoes the kinds of findings Cassandra was just talking about. So we found that older LGBT people, and we looked at people 45 and older, given our sample size, and we found that LGBT people in that age bracket were doing a lot worse than their non-LGBT counterparts. And these findings mirrored what we found in the overall LGBT sample. These disparities were similar, but in many cases worse for older adults. In particular, we see a lot of economic disparities facing older LGBT people. So right up there on the graph, you see some examples of this. We saw that older LGBT people were more likely to lose their jobs than non-LGBT people. They had problems paying for basic household goods and experienced more economic insecurity in general. And then we found, Julie, if you could please scroll down a little bit, then we found, as could be expected, and similar to what we saw in the earlier survey, that LGBT people of color in this age bracket were particularly hard hit by the pandemic, especially in terms of economic security. So they were twice as likely to have been laid off from their jobs as non-LGBT people of color. And that's just comparing them to non-LGBT people of color. The disparities become even greater when you start looking at the experiences of non-LGBT white people. And so I think what's important to keep in mind here too is that these are disparities that we saw long before these data were collected. So really what we're seeing here is the pandemic exacerbating and driving these disparities to be even greater than what we saw before. As Cassandra mentioned, we know who gets hardest hit when there's a squeeze. It's LGBT people, it's people of color, it's people with other minority identities. And that is what we saw in the fall of 2020. I also quickly want to mention, and Cassandra touched on this with some of the AARP data as well, but we also saw, if you could scroll down just a bit, a lack of sort of trust in the government when it came to how LGBT people felt. And of course, we know that LGBT people and people of color have reasons to be distrustful of the government, given the history of marginalization. So here where the government depended on creating trust in these communities for the benefit of public health, it's essential that that outreach happens and is supportive. So again, this was at the end of the Trump administration. We don't have great data on how that may have changed now into the Biden administration, but was really a signal to the incoming administration that this is a group you need to help. And this is, again, this kind of just amplifies the need to take into account this vulnerable population in all recovery efforts. Thank you.
All right, hold on.
Oh, more of the graphic.
I'm good. Do you want me to close out here?
Yeah, no, that'd be great if you could scroll down. I'll just kind of mention what you're looking at here to fill in my comments is we also saw greater concern, again, echoing Cassandra's findings, greater concern about the pandemic from LGBT people, older LGBT people. So, and then you kind of see this disconnect, right? They're more concerned about the pandemic, but distrustful of pharmaceutical companies, distrustful of the government. So that's really showing that the government and pharmaceutical companies aren't doing what they need to do to reach this population. You'd think that those things would kind of match up better if everything was working. If you're feeling scared, the government says they have a solution, you want somebody to be able to trust that. So I guess my last comment here is now we do have some data from the Household Pulse Survey. Again, those questions on LGBT identity were added pretty recently, so we don't have a huge amount yet of data to analyze, but we are able to see that these disparities are persisting even this far into the pandemic. We haven't yet been able to analyze that data based on race. Again, the sample size isn't quite big enough yet, but something we're looking forward to doing, again, to show that even 10 months later than these data were collected, not much has changed for this vulnerable community.
Thank you so much, Christy. And now I'd like to turn to Dr. Corte. I'm wondering if you would share with us what strategies and tactics that AARP employed to engage LGBTQ people during the pandemic, and what will we be doing as things move forward?
Well, that's a really great question, Dr. Bates. In terms of strategies and tactics, I think it always starts with building a longer table of partners. And one of the great things about the Out and Equal Workplace Summit is that it's the watering hole. We all get to come together from the private sector and the social sector to cross-pollinate. And, there's so much, opportunity that comes from that. And so, even in this pandemic where we've been operating largely in a virtual state, we've been working very closely with partners like Native Son and the Center for Black Equity, the Williams Institute, SAGE, and so many others. And so, we expect to continue to do that, and to do it in such a way where we're centering our commitment around diversity, equity, and inclusion. And so one of the things that you saw in the presentation that Christy just shared, where, we collaborated, she had shared, some insights on LGBTQ folks of color, and so while it's hard to find, insights around LGBTQ folks and how we fared during the course of this pandemic, finding research insights on LGBTQ folks of color is even more challenging. And that's why we have and will continue to invest in research that brings visibility to LGBTQ folks of color. Cassandra, probably share a little bit more later about our Black LGBTQ community survey that we did in collaboration with the Center for Black Equity and Human Rights Campaign, Freddie Mac, and others. And we're looking forward to working closely with the National Center for Transgender Equality next year in support of the U.S. Trans Survey. It will be the largest trans survey in U.S. history. We want to make sure that older trans folks are present in that survey, and that there are plenty of insights that we can all act upon as we all do our part.
Thank you so much, Dr. Quarte. And before I turn to Jackie and to move our conversation more to the intersection of HIV and AIDS, we've had a really good question from our participants. And so I think this is mostly for Christy and Cassandra, but the question for Morgan is, in our local queer community, we found that queer folk in general were more likely to follow guidelines and get vaccinated. And this is anecdotal data that Morgan has collected. And so we're curious if this trend is actually supported by actual data. Are we seeing, more, and actually, Dr. Quarte, you may have insights on this as well. Are the LGBTQ community more likely to get vaccinated than not? What is the data sharing with us so far? I'll start with you, Christy, if you have an answer at all.
Yeah, for sure. It probably makes sense to start with me because the data, my talk was based on our older. So they're from, again, the end of 2020. This was just as we saw the first vaccines being administered to healthcare workers in the country. Of course, there was a lot of excitement. I think there was also a lot of anxiety among people at that time. So we actually measured vaccine intentions at that time and saw that there was not a significant difference between LGBT and non-LGBT older people in terms of intention to get the vaccine. Again, that may have changed. That's something that Cassandra may have more insight on, and we may get some of that information in the future from the Household Pulse survey. But we did see a slight difference in willingness to follow recommended public health measures like wearing a mask and social distancing among older LGBT people. So I think that's consistent with that. Again, the vaccines, that was measuring intention, it may have changed. And we should have more information about that soon.
Wonderful. Dr. Quarte or Cassandra, anything to add?
I think there's the one thing I wanted to add, and I think it was a Kaiser Family Foundation study that came out several months ago. They have this really interesting insight where it found that, sort of a majority of LGBTQ folks that were surveyed, felt that sort of getting vaccinated was sort of an act of social responsibility, right? As opposed to it being sort of a personal choice. They sort of saw it as an act of social responsibility. And so, we have leaned into that as best we can. Folks can go to aarp.org/coronavirus and get some of the most up-to-date information customized to your state from public health departments, et cetera. on where you can go to get vaccinated and, everything that you need to know as far as to the extent that we know it about the coronavirus and some of the variants that are out there. And so, I think, the fact that the LGBTQ folks that responded to that survey saw it as an act of social responsibility, to me, it kind of speaks to the heart and really the best of part of our community, the sense that we're in it together. And that's not specific to this COVID pandemic. As I'm sure you'll hear from some of the other panelists, response to a public health crisis really dates way back, and I think is a part of the fiber or the DNA, if you will, of our community.
Thank you so much, Dr. Corte, and that's a perfect segue to bringing Jackie into this conversation. Jackie, you have been an activist, an advocate, and of course, in my opinion, an icon, right, in the LGBTQ space for a long time. Many, particularly those of us who look at research and look at big picture things, have drawn parallels between COVID-19 pandemic and the trajectory of the HIV/AIDS pandemic. So what can you tell us about, its similarities? Share with us maybe some of your insights into what happened at the beginning of the HIV/AIDS pandemic, what we're seeing now with COVID-19. And don't forget to take yourself off mute.
Yes, ma'am. I think, in terms of research, I remember the first JAMA article I read regarding HIV. It was, I believe, January 1981, in which they said that there was 26 men, 21 of whom were white, who had this mysterious disease. And the other 5 men were men of color, Black, Latino, and 1 Asian, and who were dying from this mysterious disease. And very early on, they called it GRIDS, gay-related immune deficiency syndrome. And then later on, it became HIV/AIDS. In between that, both in the community and outside of the community, it was the gay disease. This was also simultaneous to a crack cocaine epidemic that was happening primarily in urban areas, but throughout the country, and also a TB crisis that was going on, at least in New York City, DC, Chicago, Atlanta, again, in a lot of urban areas with high concentration of poverty, homelessness, and large immigrant populations where people were crowded into one area. So, stop me again if any of this sounds familiar. So, 30 years later, we find ourselves with a mysterious disease that is disproportionately affecting very specific communities, farm workers, people in the service industry, healthcare folks. We had leadership across the board in every sector that didn't know what was going on, wasn't clear on how to respond to it. There was conflicting information. And even when we got clarity, belief systems kicked in and the questioning of it. And the same was very true with HIV/AIDS as well. How many of us of a certain age who lived through the 80s and early 90s went to funeral after funeral after funeral where a 30-something-year-old man, mostly, died from a heart attack because the family would not acknowledge that they were gay, would not acknowledge that they died from HIV/AIDS. And oftentimes it was left to the community to take care of itself. And this is where I'll segue the conversation a little bit. With HIV/AIDS, there was no infrastructure. There were no organizations. Gay men's health crisis evolved out of that. The center in DC, the centers in California, and then choosing large city areas because that was my primary focus, but Atlanta as well. A lot of these organizations are 35, 40 years old, which is exactly how long HIV/AIDS has been in our life. So there was no infrastructure. We built the infrastructure. And many of us can't get jobs in those places today from the same places that we helped to build, right? We dropped out of school, our friends were dying, we were running the streets. For myself, I come back from my first year of college, I was 19 years old, I'd been out for a little bit and looking desperately for a community that was dying. With COVID, folks were getting sick, and unlike with HIV, where we had to come together for survival, we were being told to separate and maintain physical distance for survival. And that was the scary part, because folks got into trouble very quickly. People became ill very quickly. Testing was limited. I know my own wife, the first few weeks in March, we came back from different trips. She was very ill. She went to the doctor. They tested her for the flu, and we specifically asked for a COVID test. The test wasn't available here in Boston, Massachusetts, one of the healthcare centers of the country. So lack of information is part of the intersection. Scared, people were just scared. Conflict of information from our trusted institutions. And then once the information started coming out and being more consistent, again, another parallel was who was getting the information? How are they getting it? Were they getting it in their languages? Were they getting it through trusted communication channels, whether it's local news, print or electronic media, the word on the street, as it were? We couldn't be at the barbershops for the last 2 years, so we weren't getting the information there. With HIV, we were responsible for getting that information out. We, the community, we, those of us who worked in public health, those of us who were just coming out, we stood on the corner and handed out flyers outside of bars. We stood in our community newspapers' offices and demand that they write these letters or that they write articles talking about this disease. So we were our own, we were the ones that we were waiting for to save us. With COVID, where we are now is, I know that I have a friend who is in his early 60s, who's given so much to the community, lived in a 5-floor walk-up and came down with COVID and lived by himself. So his family made arrangements to bring stuff to his apartment building and leave it outside of his door. That was the way that they could be present. I think the other thing with COVID and HIV that I do want to just very, very briefly touch on is the disproportionate impact. With HIV/AIDS, it was immigrants and gay men and street-walking sex workers and transgender people who were on the streets for any number of reasons. Where we are with COVID is it was poor people, people without access to healthcare, people who were forced to go to work and did not have the luxury of staying home. In a panel that I had put together, one of our panelists said that they had a client who had COVID 4 different times in the first year because they were living in a 3-bedroom apartment with 13 people. And he had to keep going to work because it was mixed residency in terms of people documentation, and somebody needed to keep bringing money in. So when we talk about a health crisis, I think, one, we need to recognize there's always a health crisis. We're in the middle of a pandemic right now, but access to healthcare, access to food, access to medicine is something that has been a constant throughout my life, and I would say all of our lives, especially as people of color and LGBT folks.
Jackie, thank you so much. And you know, you touched on several different topics, and there's been talk in the chat as well. And so I'd like to kind of expand now to the whole panel and yourself, you know, because of course, you know, one of the observations that I'm seeing in the chat is, you know, oh, where'd it go? That people have learned, we've learned for public health lessons from HIV/AIDS that we've been able to apply to this pandemic. But the key component that you were talking about, Jackie, is that isolating aspect of COVID-19, Whereas in HIV/AIDS, we came together to serve and educate and care for our own. We came and we built care teams to do that. And now with COVID, it's, you have to stay away. And so I'm wondering if both yourself and the rest of the panel can kind of talk about, what do we think the biggest challenges are facing the community? Yes, at the intersection of COVID-19 and HIV/AIDS, but also at the intersection of COVID-19 and social isolation. Who'd like to go first?
I'll keep going just for a moment. The social isolation piece in COVID is also part of a larger conversation of social isolation and aging. As we're getting older, many of us are losing family members, we're losing members of our chosen family, our community, and we have health issues that limit us. I live on the 3rd floor. I'm about to have a knee replacement surgery, right? And both of my knees need to be done. The pain that I live with, the discomfort I live with affects my ability to socialize with my friends. I'm fortunate that, I live with my wife, I have friends, I see people, but it definitely affects me. Imagine having those health issues, having diabetes, having heart disease issues, having arthritis, and because you're of a certain age, maybe you were semi-closeted, maybe you didn't build community for yourself, maybe you're isolated from your community. And unfortunately, people don't access a lot of the resources that are around them as well, such as elder services. So yeah, aging and social isolation is a very real concern. It's a topic of focus for AARP in general, and definitely for my state office, and something that I think will be an ever-present challenge for us, is to help people be engaged, and more engagement equals a healthier life and a healthier lifestyle as well.
Thank you, Jackie.
I
Cassandra?
was just going to kind of jump in and say, I definitely echo everything that Jackie mentioned. And I think, this twin pandemic of racial unrest and the coronavirus was really a perfect storm for social isolation, especially for people of color who are also LGBTQ identified. We know from our studies, just really across every study that we've done on LGBTQ people, there are a high number of people that say that they lack companionship, or they feel isolated, they feel left out. And our foundation actually has a social isolation study, and in that study is showcased prior research from, I don't know who the research was, but it really talks about the physical and mental manifestations of social isolation. And there's data out there to say that social isolation, the impact of social isolation, is equivalent to somebody smoking 14 cigarettes a day. And so I definitely don't think that, loneliness or isolation is something to be dismissed. And, as we're coming, or when we move out of this pandemic, I think that there are a lot of things that we will need to really address in that respect.
Cassandra, before I turn to our colleagues, I'm wondering if there is any, and probably you and Christy can answer this question about the research. We on this panel, and those of us who are listening and participating today, all work, right? We worked, and you and I and the team assembled have been working throughout the pandemic, but we've been doing it at home. And I'm wondering if there's any research being done on the social isolation that has occurred for those of us who would not normally be isolated because we'd be going to work, and its impact on us as people, and of course as older people and LGBTQ people. Or is that just do I think we need to do that?
We probably need to look into that. From in my area, we're not doing anything around that, but I have definitely anecdotally heard from friends that live alone that, they have the benefit of being able to work from home, yet they feel lonely. And then, of course, you know, a lot of people have gotten pets.
You and me both.
Yeah, that isolation.
Thank you, Cassandra. Christy, did you have something to add?
Yeah, I think the comments made by Jackie and Cassandra were so great. And I just wanted to pick up on some things that I heard and what they were saying and talk about it in terms of the data. So, you know, Jackie kind of alluded to this, but we know that that LGBT people are much less likely in general to be married. And that's true than non-LGBT people. And that's true of older LGBT people as well. So, you know, when we're talking about not being at work, not being able to go to the store, not being able to go to the park and do these social things we used to do, if you don't have a partner at home, that is all a lot harder and compounded, not to mention some of the things Jackie mentioned where you don't have someone to help you with healthcare either. And so I think that's just really important to keep in mind, that those relationships just aren't there for LGBT people to the same degree they're there for non-LGBT people. I think it's also really important to consider how various transitions can be isolating. So I think we don't have the data, I don't think either, to your question. But it is, you know, if you lose your job and are looking for another job, even if you're fortunate to get another job, you don't know your coworkers. That can be strange and isolating. You're wearing a mask all day at work. You can't see each other, can't see each other smile, and engage in these sorts of things that we think lead to better health and well-being that Cassandra was mentioning. So, and I also want to mention, it's not only transition in terms of jobs, but we know that LGBT people are also much more likely to rent than to own their homes. And right now, with the end of the eviction moratorium, you know, we have reason to believe that many LGBT people are losing their homes. And at the same time, we're seeing that moratorium and we're seeing rents skyrocket. You know, I'm here in Los Angeles, it's been nuts, but I know that's happening in a lot of places in the country. So being evicted doesn't just mean finding another apartment. It may mean having to move, which is devastating in itself, but it may mean having to move to an area that's less expensive that you can afford, especially if you're getting out of, you know, some rent controlled apartments or, you know, so I think that we need to take into account how all of these different things that impact one's life can be very isolating, even if we don't think of it in terms of just distance between people. And I expect that is hitting LGBT people, and particularly older LGBT people, particularly hard.
Thank you. Go ahead, Dr. Corte.
You know, one of the things that we found, and Cassandra had mentioned our AARP Maintaining Dignity study, which was really our landmark LGBTQ research study, and folks can go to aarp.org/pride to sort of download that. You know, since then, we've really stepped up efforts to develop a larger canon of research insights that aren't intended to just sit on the shelf, but are intended to inform our social impact work, not just AARP, but folks that are in the constellation of AARP as well. And we found that, you know, the issues that were of great importance to LGBTQ older adults were culturally competent care, affordable housing, social isolation, and data collection. And so I just want to remind us that some of the issues that existed before the pandemic have truly been exacerbated by the pandemic. And so as we recover from the pandemic with new investments, with fresh eyes, we have an opportunity to take a fresh crack at some of the most persistent challenges, especially considering how these challenges show up through a racial equity lens. And so, you know, nothing but opportunity there. And then, you know, I also want to draw attention to caregiving. You know, there's a AARP research study that we're preparing to release based upon the Caregiving in the U.S. 2020 study. Well, you know, we have some really compelling LGBTQ insights. And, you know, we found that LGBTQ caregivers are more likely to provide care alone. 45% of LGBTQ caregivers are providing care alone with no paid help, no assistance from other unpaid caregivers, compared to other caregivers that don't identify as LGBTQ. That, in addition to the physical and emotional toll of caregiving, that, in addition to the financial strain of caregiving, means that we have an opportunity to provide some relief. And I know that AARP has joined a coalition of folks that are fighting for paid family leave. That's currently being debated in Congress right now. We have a very generous paid time off policy for caregiving at AARP, but we also understand that's not enough. Everyone should have, paid leave to be able to care for their loved ones, to care for their family members. And so that gives you hopefully a flavor for not just what we're working on, but what we can all do together.
Thank you so much, Dr. Corte, and everyone for kind of going deeper. And as we've been talking, the chat has been blowing up. Of course, a lot of the conversation on chat is in regards to our pets and how our pets have saved us from social isolation, whether we adopted them or they adopted us, and whether we're supporting them or they're supporting us. But another thing that's really coming to the fore in our chat is about housing, right? We've talked a little bit about that, and I'm going to ask Cassandra and Christy if they have something more to add. But I also want to let everyone know, our panel today isn't talking a lot about housing, but AARP does a lot in regards to livable communities. We are a partner with the World Health Organization to bring these concepts, the 8 domains of livability and more to the United States. And so if you're really interested in things like co-housing and LGBTQ specific housing and what it means to be in a livable community, after we're done today, go to aarp.org, livable communities, and you will find more resources and you will know what to do with on any given day, because we produce a lot of great stuff, but it's there. But Christy and Cassandra and anyone on the panel, do you have anything to share additionally about housing specifically and COVID-19 that our participants should know about?
Well, I put a couple of things in the chat because somebody mentioned LGBTQ specific housing and co-housing, and just some of our partner organizations and SAGE, the housing that they have, Open House in San Francisco, Mary's House for older adults. In terms of research, we have a study coming out, I don't know when, but I specifically asked that there be a question about co-housing or home sharing. And we do have an oversample for LGBTQ, so it'll be interesting to see that. And I think Nicole, I could talk a little bit about the SAGE index.
SAGE, and we've been working with SAGE for a very long time, well over a decade, and hat tip to Aaron Tax and Michael Adams and Hillary and the team over at SAGE. They've been working very closely with the Human Rights Campaign on what they call the long-term care equality index. And so very similar to, some of us may be familiar with the corporate equality index that HRC has produced over the years. Well, this is a long-term care index. And so for folks that are having to consider long-term care, this is a really great resource to make sure that folks are getting that care in places that are LGBTQ affirming. And so, it's a great little sort of rating index. And it's also very helpful in helping us to think about, well, what criteria should we be considering when we think about long-term care for ourselves or for our loved ones? And so I want to encourage people to check that out. AARP, we hope to be supporting that work in some way, shape, or form in 2022. In fact, we're meeting with SAGE tomorrow to talk more about that opportunity. But it just underscores the heavy responsibility that caregivers have across the country, and Cassandra and Christy and Dr. Bates and Jackie have heard me say this a million times. I'll say it a million more. No data, no justice. And what you're finding is the more data that we are collecting on LGBTQ folks, and might I add, LGBTQ folks of color, we are able to more squarely develop interventions and develop solutions, that meet more of our community where they're at. And so, I'm sure we're in good company here at the Out and Equal Summit. But if we can do it as over 60-year-old organization, fighting for America's 50 plus, then so many organizations that are gathered at the Out and Equal Summit can do it too.
Oh, Dr. Corte, it's always so wonderful to hear you talk. And you get us excited about no data, no justice. I mean, everyone's talking about that, and no data, no justice. Before we move to our next question, Jackie, I see your finger, so please take yourself off mute and talk to us.
Just, being a lesbian of a certain age, I just want to remind people, I recently read an article where women in the 70s had created a community for themselves across the country. And, we saw it in the terms of women's festivals, et cetera. And this article featured one community that is shutting down because people are aging. No younger people, women, have chosen to join these communities. And there's several across the country, but this was one particular one. And so, self-determination also. We were in one place at one time, people were buying land in the woods and they were building homes, et cetera. And you're smiling because I'm sure you've heard of some of these conversations, or maybe went to a women's festival or two in your lifetime. But where we are today is, for those of us in urban areas, I'm not moving to the woods. So there are organizations like SAGE, there are smaller organizations that are just buying a building and are creating apartments and opportunities and community spaces within those buildings, or compounds. I'm seeing a lot of converted school buildings and converted churches that are being turned into some form of housing, whether it's low to moderate income condos where people can get in, or rentals, et cetera. So I would just say to folks, keep an eye out, keep your ear open to what's going on in your community, and learn more about the local stuff that's happening around housing, and housing for, quite honestly, the 50 plus community, or if you prefer, seniors.
Thank you so much, Jackie.
Dr. Bates, can I respond real quickly to Harry Gittleson in the chat box?
Sure.
He had made a comment where he said it would be great if both AARP and SAGE jointly came out with a guide for the best cities in the USA for LGBTQ individuals and couples to retire. So there is information that exists currently. Human Rights Campaign has something called the Municipal Equality Index. And I would encourage you to sort of look at that as a standalone. In addition, AARP, has taken in that data. It's one layer of data among other layers of data that make up our livability index, which you can also find if you go to aarp.org/pride. In the search box, just type in livability index and it'll come right on up. One of the domains of livability is respect and social inclusion. And so that's where that data from HRC comes into play. I hope I answered your question. I see Harry has his hand raised. And so that means I either didn't answer the question or there's a part 2 to his question.
And I'm not sure if Harry can talk to us, but Harry, can you give it a try? Take yourself on mute and you can ask a question. Harry, we can't hear you. So it sounds like we don't have that option, but put your part 2 of your question into chat, and we only have 10 more minutes together. So I'm going to kind of pivot now this conversation. It still applies because, of course, for those of you that don't know, there is something called the Equality Act. And so I would like to ask our panelists if you would share with us, what would right? What would the passage of the Equality Act mean for LGBTQ people? And Cassandra, I'm going to start with you.
Okay, I want to make sure I wasn't still on mute. One data point that we have from our State of LGBTQ 2020 research was that, and this is, a no-brainer, 92% of LGBTQ people, support federal protections from discrimination based on sexual orientation and gender identity. We know from multiple studies, upwards of 3/4 of LGBTQ people have said that they have faced discrimination based on either sexual orientation or gender identity. And so I think it would mean a lot. I think, one of the biggest things, it would help people to feel relieved. It would be a relief from the anxiety at work, the fear of being fired or outing. Same thing in terms of, Chrissy touched upon this earlier, housing and rental discrimination. And, I think for LGBTQ people, it will be that level of dignity and respect that we want and we need and we deserve. And I think along those lines, I think that a lot of LGBTQ people are also looking at companies that have DEI statements that, maybe even came out in support of Black Lives Matter, to see if they are supporting the Equality Act. We know, and I'm sure Dr. Corte is going to touch upon this, about our support at AARP for the Equality Act.
Well, Cassandra, with that, we'll turn directly to Dr. Corte. Go ahead.
Thank you, Cassandra. One of my proudest days at AARP, and I'm sure a number of my colleagues may feel the same, was when AARP on the 50th anniversary of Stonewall to the day came out and publicly endorsed the Equality Act and sent a letter to the United States Senate encouraging the U.S. Senate to take up the Equality Act and to pass it. We have come out in support of the Equality Act not just once, but now twice. And so make no mistake about it, AARP is squarely behind the Equality Act. And for the folks that are gathered here at the Out Equal Summit, if your company, if your organization has not come out in support of the Equality Act, we'd encourage you to join AARP and so many others. And not just coming out in support, but finding creative ways to activate our support and to make our voice heard. And we all have an opportunity to answer this question. What would passing the Equality Act, what would that mean? From our vantage point, what would that mean? Based upon whatever it is that your business does or where you're located. We found in our research that 34% of LGBTQ folks felt the need to hide their identity in order to obtain suitable housing. We found that over 40% of Black and Latino LGBTQ respondents felt like they had to contend with discrimination in a healthcare setting, not just based upon their race and ethnicity, but also their sexual orientation and gender identity. And so passing the Equality Act would make a material difference in how members of our community are able to navigate our healthcare system. Passing the Equality Act would help folks to feel like they belong in the communities where they live, work, and play. Passing the Equality Act would ultimately extend a level of dignity to our neighbors and to our friends and our loved ones. And you can't put a price on that. And that's why, we're working so hard to help make this the law of the land. We are encouraged by the Supreme Court decision that has now maintained that LGBTQ employment discrimination is against the law in the United States. But we have to go further in terms of housing, in terms of public accommodations and civil rights. And we won't stop until we succeed.
Thank you so much. Jackie, do you want to add anything about the Equality Act?
I think it's just really important that people read up on it. know what it is that we both as individuals and as an organization that represents the 50+ community, AARP, is supporting, and find a way to support it as well. As Dr. Cortez said, you know, have your organization write a letter of support to the Senate. You become involved, you can sign petitions both online and send something to your elected officials. We can't do this alone. We can't just keep building communities alone or within ourselves, that we have to have the support of our elected officials in order to have the rights that we so justly deserve. So please find, whether in a big way or the most minute way, to get involved and support this.
Thank you, Jackie. And Christy, any closing words on the Equality Act?
I just want to echo what everyone has said. These points are so great. You know, something that Dr. Corte was saying just made me think too, you know, this Supreme Court decision in the Bostock case that he was talking about is amazing. The Biden administration has made significant strides in getting that decision implemented across civil rights laws that protect people from discrimination based on sex, and interpreting those to also protect LGBT people. But what we also know is Supreme Court decisions can be fragile, and that decision could even be limited by other courts. We have, you know, some reason to believe that some courts and judges may read Title IX to offer different protections, for example, than Title VII, so that those protections wouldn't also apply in education. Of course, we know administrative policies are also very fragile. We saw the Trump administration overturn many progressive supportive policies that were implemented during the Obama administration. So getting these words, sexual orientation and gender identity, into federal non-discrimination statutes is going to be the strongest level of protection we can get for LGBT people nationwide. So I think while all of these other developments are so encouraging and are offering protections to millions of people, they're short of what statutory protections are.
Well, thank you so much for that passionate endorsement of the passage of the Equality Act. And in the 1 minute that I have left, I will encourage all of you to call your senator, whoever they are, wherever you live, they work for you. Tell them that you expect them not only to bring the Equality Act to the floor of the Senate, but to vote in favor of it. It has truly been a phenomenal opportunity to be together today in conversation about LGBTQ older adults and the unique intersections of COVID-19, HIV/AIDS, and housing, and everything else that we've talked, social isolation, and everything else that we've talked about today. Thank you so much to my panelists for joining me in conversation, and thanks to all of you for being part of this conversation today. Thank you so much. Right on time, we're done.
Thank you, Dr. Bates. Thanks, everybody.
Thank you, everyone. That was great.
Thank you.
That's pretty awesome.
Thank you, Cassandra.
Thank you. Feel better.
All right.
And I think all we do is leave now. So thank you so much.
Thank you.
Bye-bye.